All right, guys, lower eyelid retraction, another one, right? I think I posted about this patient earlier a few months ago on how are we going to handle this. She had a transcutaneous lower eyelid blepharoplasty, which again gets really demonized, but I don't think it's as bad as people say it is. But regardless, her lid pulled down, super dry. This lid is stuck, fused down here. So we need to find a way to get her eyes to feel better, to improve the surface of her eyes so she can see more clearly, right? Because when your eyes are dry, you're going to see blurry no matter what, right? So if your eyes are, if your eyelids don't close, your eyes are going to dry out, which means your vision is going to be blurry. So we need to help her eyelids close for that. We also want this to cosmetically look better, but that is a side effect of us functionally making this look better as well, right? And now there's different ways we go about this. If someone's going purely through insurance, there's a lot of cosmetic steps we can do to get you the best cosmetic outcome. If you're going purely cosmetically, there's some more stops we can pull out in terms of the grafts, in terms of the techniques and all that. So anyway, this patient, she was just a week out, so that her before half is there, after half is there. So we flipped the photos to show you a contrast view of what all we did. We did an endoscopic approach to the brow and mid-face, and this was connected to a very extensive lower eyelid dissection where we had to release scar tissue from the front and from the inside so that this can all become one continuous plane, something that I do in my most aggressive lower blepharoplasty techniques, which is like essentially a full deep plane blepharoplasty, which will lift all of this, all of this. We make an incision underneath the eyelashes. We are able to remove a lot of extra skin this way safely. We do a canthopexy or canthoplasty. In her case, we need a little spacer graft. We actually ended up removing a little more extra skin on her, very conservatively, but just because it was bunching up, because we got such a good mid-face lift out of this, lifted up the whole cheek. So pros, she's going to be able to close her eyes again. Her vision's going to start improving. We're actually helping stave off a facelift for a few years now too. She had a couple of brow lifts before that had both failed, and so now that lateral brow's up again. For me, the goal of doing this lateral brow lift was not to raise her brows; it was just to prevent bunching for when we lifted the cheek up, to just help us release this area fully. So it's one kind of leads to one, which kind of leads to one, and but yeah, so she's doing much better. She's going to keep healing. We just did another check-in. And that's about it.